We are so glad to have you all here with us today for this Wednesday press event. Today, Mayor Demings will discuss our positivity rates, COVID-19 testing numbers, vaccinations, and this includes testing and vaccination locations. Also today, the mayor will briefly talk about remembering a sad event from 5 years or so ago. Dr. Raul Pino from the Florida Department of Health in Orange County has traveled out here today with information on state testing numbers, rates, and trends. And Comptroller Phil Diamond is also here to discuss tourism development tax collections. We begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. Thank you to all of you for being here. As we continue to experience what I call our new normal, it seems a bit odd that we don't see you as often as we were seeing you during the last year. But it really suggests just where we are as a community, that we are truly recovering from the pandemic that really affected our lives daily for such a long period of time. This afternoon, we are obviously here at the Orange County Convention Center, and there has been a beehive of activity going on here throughout the day. We're open for business, and that's good news for our local economy. In fact, during the month of June, 14 events will be held here this month. Starting next week, the AAU Junior Nationals Volleyball Tournament will be in full swing. Nearly 139,000 attendees will fill these halls, and the event is estimated to generate, now get this, nearly $178 million for our local economy. I think that's good news. There's no doubt we are emerging from the dark days of the COVID-19 lockdowns 1 year ago. Controller Phil Diamond will provide the latest tourist development tax receipt figures for you in just a moment. But I also want to talk today about where we are. We are in phase 3 of our reopening plan here within Orange County, which, as you all may recall, at the State of the County last Friday, we announced that we were no longer under a state of emergency here as a community. But we also announced that on Saturday we would likely hit that mark where we had a sustained 14 consecutive days of positivity rates below 5%. And Dr. Pino is going to talk more about that today, about the rates. But I will share with you that what that really means, as we are in phase 3, is that Orange County no longer has any mandates that are county-driven or as a result of the executive orders that I have put in place as the countywide elected mayor. We still do have federal mandates in place regarding airports, public transit, as well as correctional facilities and then federal facilities. They have the authority to direct those locations. Now, when you move throughout our community, you will see some private businesses that still are requiring the wearing of facial coverings in some cases, and that's their choice. That's a decision that they have to make. You still see individuals who will continue to wear facial coverings. Not everyone in our community has been inoculated at this point. We are still encouraging people to get inoculated, and I will talk more about that in just a few moments as well. But we are indeed recovering. I continue to stress that we do follow the Centers for Disease Control recommendations and guidelines. Dr. Pino recently was informed of a new level of evaluation that has been assigned to our area. I'll let him get into that in just a few moments. But our COVID-19 vaccination numbers continue to be encouraging. The Florida Department of Health in Orange County reports that 54.14% of county residents 12 and older have had at least one dose of the vaccine. Dr. Pino will tell you that that number is underreported because we still do not yet have the numbers from those that have been done at federal facilities such as the VA hospital or clinic here within our area. But since the pandemic began, there have been 144,035 positive cases of the novel coronavirus reported within our community. And we still have 1,321 residents who have lost their lives to COVID-19. That's a number that I'm not particularly satisfied with, but it is what it is in this community. And that really suggests that even though the spread of the virus has slowed down significantly, it is still a threat within our community, and we still urge people to get vaccinated. This week, Advent Health started offering the Pfizer COVID-19 vaccine at 4 Central Care locations here within Orange County. The vaccine is available to anyone 12 years of age or older at the Central Care locations. I'll give the 4 locations. Colonial Town, which is on North Bombay Avenue, has a location. Lake Nona on Lake Nona Place out in East Orange County. Winter Park has a location on Loma at the Central Care there, and then in the Winter Garden area at the Winter Garden Central Care on Daniels Road. For more information, you can certainly go to their website at centralcare.org for more information. Orange County continues to offer free testing and vaccinations at Barnett Park each day between the hours of 9 a.m. and 5 p.m. If you want to get vaccinated, you can select either the Pfizer or the 1-dose Johnson & Johnson. If you want to be tested again, you can receive the molecular PCR or the rapid antigen test. You can get information from ocfl.net/testing. Also, Access Links and Orange County government continue to provide free round-trip rides to Barnett Park for those vulnerable seniors 60 years of age and older who lack transportation but want to get to Barnett Park to be vaccinated. You can just simply dial 311 and we will facilitate that process. As individuals from across the nation now are celebrating LGBTQ+ Pride Month, it is also a time for us to reflect on the 5-year remembrance of the Pulse tragedy. Many of you know that on June the 12th, during the early morning hours 5 years ago, it was something that happened in our community where 49 innocent lives were taken on that day. As the Orange County Sheriff at the time, I had the opportunity to respond to that incident, and I saw the tragedy up close and personal, firsthand. And from that day, we have continued to, as a community, recover from that and deal with the trauma associated with the multiple families and individuals who were impacted by that. In fact, I believe all of America and perhaps the world, because it was a multicultural group of individuals who were patronizing the club, and so it really impacted many. It was a media frenzy, I would say. For about a week, we had 3 tragedies within about a 4-day period of time that really put us on the map for a lot of things that we don't necessarily want to be remembered for. But yet it was a period of time that created a bonding opportunity for our community. As we grew together, I think we improved in the way we treat one another and the respect that we have for the differences that we see within our community. But we came out of it stronger as a community. And so I'd like to remind residents that they can watch the 5-year Pulse Remembrance ceremony hosted by One Pulse Foundation this Saturday, June the 12th, between the hours of 7 p.m. and 8 p.m. at the Dr. Phillips Front Yard Festival in downtown Orlando. I also want to point out that there is an exhibit about the experience that Orange County is hosting at the Orange County Regional History Center. The exhibit is entitled Community, 5 years after the Pulse tragedy. The exhibition brings to life the story of the Pulse nightclub from its earliest conception through the present day. To ensure that you can have access to the entire exhibit, we ask that you consider going between now and June the 13th. It is free, by the way, so the price hopefully is right for those who may be considering attending. And with that, I'm going to turn it over to Dr. Pino at this time, and then we have the Comptroller, Phil Diamond, who will come up and offer some numbers. Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. The county has an accumulative number of cases of 144,035. Our positive rate, recovery rate continued to be of 98%, and our 14-day rolling average is at 4.1 and continue to decline. The number of deaths, unfortunately, went up by 11 since we talked to you, since we offered data on the second was the last time. 6 female, 5 male, 1 Asian, 5 black, 4 white, 1 older, 2 Hispanic, 9 non-Hispanics. 6 has underlying conditions, 5 we don't have that. 9 of those deaths are from the month of May, and 2 are from the month of June. One of the individuals, for 9%, was a resident of a assisted living facility. With regard to vaccinations, let me first say that you are going to notice a decrease in the percentage just slightly. It's because we add the population for 12, so we are not calculating 16 and up, we are calculating 12 and up. Just to give you an idea, our population 12 and older is about 1.2 million. We have vaccinated, at least with 1 dose, 618 individuals who are 12 years or older, and that is a 54.14% of our population. For the same population, completed series, 541,741 individuals are fully immunized, and that is 44.46% of the population. The mayor mentioned to you about the many locations that are offering vaccines in our county. So have use of these. They are closest to you, especially the pharmacy, the groceries, the Walmarts. Those are very close to our communities. And also, we started to vaccinate at the airport. We have, in collaboration with the state, running an experimental phase until the 18th. After that, we will decide if it's sustainable. We are offering vaccines at the airport. The vaccines are intended for airport employees and that work on shift 24 hours a day, every other day. And also, we are interested in vaccinating our residents that are coming into the county from international locations and other locations around the world. But it will also vaccinate anyone that may meet the requirements. Another note, Orange is now orange. So the CDC has graded us out down into the infection rates and the risk from red, which was the highest, to orange. And we will in yellow a couple of days this week that we hit really low numbers. And I'm expecting that we will soon probably move to yellow on a permanent basis. The levels are high, which is red, where we were, substantial, which is yellow, moderate, which is substantial, which is orange, moderate, which is yellow, and then low. Finally, as the press conferences are winding down, our pandemic response has changed. For those who want to continue to be in touch with the health department through social media, remember our handle at DOH Orange for Twitter. Thank you very much. Raymond, Controller Diamond. Thank you.
Thank you, Dr. Pino. Well, for the month of April, our tax collections received were $17,032,100. That, compared to last month, is slightly lower than March collections by about $600,000. However, that is a 2,040% increase over last April. Yes, 2,040%. And as you'll remember, last April was the month where we hit rock bottom. It was the month when collections dropped 97%. They essentially disappeared last April. So This month's numbers will look very high in comparison to last April. They still are lower than the April before that, the last pre-pandemic April that we had. They're still about over $8.5 million less than April of 2019. So clearly, we still have a way to go. That's also less than we received in any April since, I think, 2013. Typically, we would have our chart on the screen behind us. We don't have a screen behind us today, but just to remind you, the chart starts fairly high back in 2019. It's about flat through 2020, and then it drops, kind of like the Disney Tower of Terror in April of last year, and now it's heading back up. And, you know, looking at these numbers, whether it's a 97% drop or a 2,000% increase, it seems like the ride that the tourist tax has been on over the past year could rival the rides of any of the roller coasters at any of our theme parks. So looking ahead, between the very positive vaccination numbers and the better news that we're hearing about COVID infections, it's clear that the immediate future looks very promising. I will say on the expenditure side, the county has continued to use TDT reserves to offset ongoing TDT shortfalls. For the month of April, reserves decreased by about $7.2 million. And that information is on the cash reserve information that we've provided to you, and we'll be happy to provide to you if you didn't get it. The majority of that was due to payments related to Visit Orlando, Arts and Cultural Affairs, the History Center, and funding of the Convention Center 30-day operating reserve. In total, the county has used a little bit more than $145 million since the beginning of the pandemic, and that's been taken out of reserve since the beginning of the pandemic. And I'll be happy to take any questions when we get to the question period. Thank you.
Okay, just as a reminder, if there's any Spanish-speaking media here, we have the ability to do translations. We have Ilya Torres, one of my special assistants here. Dr. Pino is fluent. We have also Commissioner Gomez Cordero has joined us, and we'll open it up for any questions that you may have at this time. And let's see. They do have a mic that will be moving around. And while they're getting prepared for that, the next press briefing that we'll provide will be done on June the 16th at 4:30 p.m., and it will be back at County Administration. So with that, we'll open it up for our first question at this point. Yes.
Yes, this is Melissa Thomas with Florida National News. Just wanted to get your personal thoughts now that things are starting to buzz back up here at the Orange County Convention Center, now that the requirements have been lifted for Orange County. Like, what are your thoughts on seeing Orange County kind of return to normal a little bit?
I think it's fantastic that our convention center is open. We have been able to capture some shows that have relocated from other communities who are not yet reopened. I believe that when the May numbers come out, May of 2021 numbers, they will be higher than April of 2021. So Controller Diamond gave you some fairly good news. It's 240+% up from April of last year, which is the last month that we have numbers for. But the May numbers will be out soon, and I believe they will be good numbers. We know that June's numbers will be good numbers because of the number of bookings that we have now through the remainder of the year. But as I kind of focused earlier, with the show coming in next week that will bring in $178 million of economic impact on our community, it makes me feel pretty good that our recovery is happening sooner than later. A lot of communities will love to be where we are at this point. So that's the good news. And Dr. Pino shared with you the news about the CDC and the rate of infection being at this point a moderate level. So that's a lot for our residents to look up to. I believe that it will create job opportunities. We have our employees from Orange County who have been reassigned to other assignments within the county who are now back working where they were primarily employed to work, and I think all of that creates an atmosphere of positivity within our community.
Lauren Seabrook, Channel 9. My question's for Dr. Pino.
I could have guessed that.
Some things never change. Dr. Pino, last week we learned from the state that they would no longer be issuing the COVID case numbers and deaths daily, just once a week now. Brought up a lot of concerns in the public about transparency, which has been obviously a huge concern throughout the pandemic. What can you say to those folks who want to know why they're not able to see those numbers daily and who have concerns that if the numbers do start to go back up, we won't know about it in a timely fashion?
So that would be for the rest of the state. Orange County will continue to have daily analysis because we have that capacity in-house. We build it. I think that the state is moving in the direction that the pandemic's moving, in the sense that we are scaling back from the frenzy of fighting the pandemic. We are more into containment. And at that level also, many of the emergency operations of the states are also scaling down because cost and other things that are associated, but also in response to the changes that we have seen in the pandemic. But we have the local capacity, so our numbers will continue to be daily. We continue to have executive team meetings with the mayor 3 times a week. So that data is to provide the mayor and the county with the decision-making process that they may need. No, but we could, if necessary, release it to you in a daily format in the afternoons after the analysis is complete, if that's necessary. Mm-hmm.
Kelsey Thorne with the...
I just also want to acknowledge Scott Howard came in. He's over here from the school district if there are any questions for the school district as well. And so we'll go back to the Q&A.
This is Kelsey Thorne with West 2 News. My question is also for Dr. Pino. You talked about offering vaccines at the airport and offering them not only to employees but also to passengers getting off of flights. Can you talk a little bit about that and how that's going to work? And, you know, we have our first international flight coming in today. So would it be for international people coming in?
So the vaccines are not intended for travelers. And I say intended because it is intended, the volume that we are generating. There right now, the first day I will believe only 60 vaccines were given. So we are expecting that to increase. We don't know what the response is going to be. Miami is another international airport that is doing this effort. So the idea is to immunize the people that are coming into the county, especially if they are county residents. That's the intent. And that's why we are setting up. So as you see, we are setting us as a pilot until the 18th to see what the uptake is. We are not expecting people to, people come on very restrictive flight times and they want to get to the hotel and want to get to the attraction. So we are not expecting large number of travelers to take up the vaccine because, again, the dynamics of an airport environment where you have to arrive 2 hours in advance to be able to go through checkup and move through security and get to your gate. So it's not intended for travelers, although if we vaccinate a traveler, that's absolutely fine. At this point, we have an excess of vaccines and not uptake from the county residents. But it's also important to vaccinate those who are coming into an environment when we only are vaccinating about 54%. So that's the intent, but it's not intended for tourism, although it could happen.
I have a question for Mayor Demings. This is Stephanie with Fox 35. So the county recently launched this needle exchange program. What are the goals of this program as we've seen an increase in overdoses? And then programs like these have been controversial in other parts of the country that we've seen what would you say to someone who maybe questions why taxpayer dollars would be used for programs like these?
All right, first off, under the current Florida law, no taxpayer dollars can be used for that. So through a foundation, dollars have been raised to make the program a viable program here. The goal is to reduce the contracting of disease. Obviously, sometimes with intravenous drug users, they develop venereal diseases and other things, and we have seen a slight spike in those numbers here within Orange County from those who are contracting HIV to other things. And so what we want to do is use the needle exchange program as a hook to get individuals into counseling, into treatment, and to provide clean needles from them to help stop the spread of disease within our community. So it's really, at this phase, it's a pilot program that we have undertaken here in Orange County, and we'll monitor how that impacts the spread of disease and even drug usage. Obviously, you did comment about the uptick in overdoses within our community. There may be a multitude of reasons why that has occurred, but as we respond to drug overdoses, you know, there's a criminal element associated with that, but there's also, I think, a compassionate element there where we want to treat individuals and to get them away from the addiction. And so the needle exchange program is a proactive measure that we have in place to complement our efforts to take care of the citizens here within Orange County. Okay, other questions?
This question is for Mr. Campbell with Channel 6. For our TDT reserve numbers, what is our running total since the beginning of the pandemic that we pulled from? And then looking ahead, realistically, what month do you think we'll get to when we no longer pull from that reserve?
To answer the second question first, not soon enough. We've used about $145 million since this all started. And you know, obviously, if your collections go down, you still have ongoing expenses. You know, we're all here at the convention center. Thankfully, the air conditioning's running in here, but it costs money to run the air conditioning and to maintain a building like this. As far as how soon we might go from we might go from an ongoing loss situation to an ongoing increase situation. Hopefully very soon. Hopefully as the roller coaster continues upward, we'll start seeing some money going back into reserves. And I think if we have another month like this one, or hopefully a better month, it might be as soon as next month. Yeah.
This is Steve Hudak from the Orlando Sentinel. I am wearing my mask still. My mother, we're always worried about everything. So this is one for you, Mayor, you, Phil, and you, Dr. Pino. What are you worried about now that we're seeing the light of day?
I guess I'll take the first stab at it. For me, the worry is that people will become complacent, and those who have not gotten inoculated will not go to do so because they don't think that is continues to be necessary. But I would urge those who have not gotten vaccinated to get vaccinated. I would urge parents or other responsible adults who are guardians of children to consider getting their eligible children vaccinated as well. I believe that if they have the vaccine, they're in a better position when school reopens to have their children interact with others in unknown circumstances in terms of their exposures. So I'm not the epidemiologist, but I do listen to the advisors that we have who are well qualified, like Dr. Pino and our other healthcare partners here in this community. They all still say that we're still not yet where we should be in terms of want to be. We have not reached that 70% or 79% threshold. You heard the numbers today. So there's still work for us. and I just don't want us to get complacent. That's why we continue to have these press briefings. We continue to put a face on the fact that COVID is still alive and well within our community. Dr. Pino?
Yeah, I share the same concerns. The younger segment of the population is my concern. We have reached high level of immunizations among the older segment of the population. In some cases, for 65 older, it's in 78, 76%. I think I have it here. 77 for 65 plus, 77.63. But if you look, for example, only 12,000 kids between 12 and 17 have been fully vaccinated, and the population for us being 12 to 17 is 105,000. So it's a huge gap there that we have to engage. And in this case, parents hold the key because they made the whole decision for those minors. And it is important to understand that soon enough, a school year is going to be here. Many of them will go back to school into congregated settings, and it's critically important that they are immunized to protect themselves and to protect others and to protect the teachers.
And just a couple of things. First, we're all vaccinated in my family, but I hope everybody else will consider getting vaccinated because until we get to the point where there aren't any more cases, people will continue to get sick. We'll still have some impact in the economy, some impact on our tourism business. And clearly, I think everybody wants to see that turnaround so everybody can be back at work. From the standpoint of TDT, which might be what you're asking about as well, you know, we've had some good months, and I hope that continues. And people getting healthy, if everybody's healthy, we're going to continue to have more good months. You know, last year we didn't know where this would end. We had our 97% decrease. We had a lot of other really bad months. It's starting to turn around now. And I hope people realize that even though we've had a couple of good months, one of the things about TDT is it can turn around on a dime. You know, you might remember after 9/11, we had a 33% drop or whatever or so after 9/11. We've also had some very good months. So I hope that people will keep in mind that we've got a long way to go to get back to where we were. We've got to get a long way to go to get back to replenishing the reserves. And I hope that you know, and I think this is not something I worry about, something I look back on, and I didn't know if anybody was going to ask me about this being out here at the convention center, but you know, last year, Mayor Deming stopped the expansion of the convention center, which I think was an unpopular move, but I thought it was the right move when you look at where we are and where we've ended up financially so far. We've got, I think, $36 million or so left in our undesignated reserves. And I think if that decision hadn't been made, we'd be looking at a very different picture today.
Question for Dr. Pino in Spanish. Edgar from Telemundo. Doctor, importante lo que acaba de mencionar sobre la vacuna en el aeropuerto. Esta época del verano, muchos viajeros, muchos vuelos desde Colombia, desde Puerto Rico, desde otras partes de América del Sur. Los familiares en esos países donde sabemos que no hay vacuna, van a ver una opción, pero súper valiosa, de poder hacerlo en el aeropuerto de Orlando. Y esto va a ser una gran noticia, creo yo, en lo que es la población hispana. ¿Piensan incrementar esa disponibilidad? ¿Cuál es el plan? ¿Todo viajero que llegue de afuera van a ser elegibles? ¿Cómo va a funcionar esto un poco que esta noticia va a caer fuerte en la población hispana?
So the question was, what are the implications of vaccinations at the airport for travelers, especially from Latin American countries where the vaccine is not available as it is in our country? And I'm going to answer first in English and then I move to Spanish, because there is a point that I want to add to my prior response on this matter. If you realize we have put the vaccination close to arrival flights, not departure flights. Our intention is, again, to vaccinate people who are coming into our county, and mainly county residents and people who work at the airport. Para responderte en español, como había dicho anteriormente. Empezamos a vacunar el lunes en el aeropuerto. Es experimental, lo tenemos garantizado hasta el día 18 de junio. La idea es que el objetivo es vacunar a los residentes del condado y las personas que trabajan en el aeropuerto. El aeropuerto es grande, está abierto toda hora, todos los días. Por ende, las personas tienen dificultad en vacunarse. Y también recordarle a la población que en el aeropuerto tuvimos unos cuantos outbreaks. Los tuvimos en TSA, los tuvimos en algunas de las aerolíneas y queremos mitigar que eso pase en el futuro a la medida que el condado se recupere económicamente, que el aeropuerto esté funcionando adecuadamente, es parte de esa recuperación. Y ese es el objetivo. Por supuesto, puede suceder que una persona que venga de visita se vacune. No es la intención, pero no vamos tampoco a negarle la vacuna a alguien que esté viniendo en el condado y la necesite, teniendo en consideración que tenemos un exceso de vacunas, que algunas pueden expirar en fechas cercanas y que es mejor que dársela a alguien que la necesite.
Ron with News 13. This is also for you, Dr. Pino. There's some concern about the new Delta variant, first identified in India, that's now becoming the dominant strain in some parts of the world. And of course, this variant is, people who are unvaccinated are particularly vulnerable to this variant, including those children who are not eligible yet. So what's the current level of concern based on what you've read about this particular variant, and how would you like to, I guess, kind of use that as further reason for people to?
So the concern that we have with the variant is the same concern that we have with all the variants that came before that one and all the variants that may come after that one, is that you never know what the modification, the genetic change is, and how that's going to be affecting individuals. In our answer before, we also insist and continue to insist in people who are younger than 18. There has been an increase of hospitalizations around the country for people that are in younger age. I just asked today for an analysis to be done in the death rate and the age, because from seeing the data, I'm suspecting it's getting younger, and that concerns me. So those are the concerns that we have. As we vaccinate the older segment of the population, this segment will be more affected and susceptible to any of those variants that may come in the future. And again, although children and younger people tend to have a much better health outcomes, it still do happen. Still people of young age get hospitalized. People of young age still die from this. We have a few in our county. And what kind of, where do you leave a family when you lose someone for something that could have been prevented? We have it, we have the vaccine, we have it everywhere. Please take it.
Okay, that appears to be it for the questions. Again, the next press briefing will be at County Administration on June the 16th at 4:30 p.m. And we'll remain if there are any one-on-one questions at this point as well. Thank you all for joining us today.